Welcome, ma'am, to the interview, and thank you for doing this interview. Yes,
Thank you so much for having me.
yes.
My pleasure.
So I'll go on to the questions. What was your vision when you founded Samvaad Institute of Speech and Hearing?
So when I started, the vision was to create an institute which would be a benchmark for a balance between clinical and theory.
Hmm.
Because as you know, we have been to theory. All my training was so theory oriented.
Hmm.
And after I did my behavior analysis, I realized the importance of mentoring.
Hmm.
What is it that what it does to a person who is mentored? You get mentoring and clinical support and supervision, what it can do to you, how you can improve as a clinician.
Hmm.
And therefore, I wanted to, if I was going to start an institute, first of all, I was too scared, but then the I decided to do it, so then I had to do it.
Yeah.
And when I started, that was my vision. I said, if I'm going to do this, it should be like that. It should be a balance where the students get good orientation on all aspects.
Okay. What are your core values as a person, and how do you think it has impacted Samvaad?
I I am a very honest person. I think that's what I feel. I do everything with great honesty and transparency. But what is the impact in Samvad that you all must tell me? I don't know what how it shows in Samvad, but I try to do my work as honestly as I can, as true to the child that I or the client I'm serving, and as transparent as any. I mean, I share everything with the client's family. I don't hide and say, okay, I won't tell them this, then they'll stop coming to me. I don't think like that at all. I'm always, I think I share a lot and I explain everything to people. But I don't know whether you have to tell me whether that has comes through to my clients, to my institute. Is that the way people think about Samvad and how my students have imbibed this? I don't. But I try to do this.
Yeah. How would you describe your career thus far?
Unexpected, unexpectedly wonderful. When I did finished my masters in '87, there were no career options. There were not much career options for us. You either, if most of them went abroad. I was very clear I didn't want to go abroad. So there were two centers in Bangalore that offered jobs, and there might have been some 4 posts. Nimhans had one or two posts, and Chandrasekhar Institute had opened, had about maybe 8 or 9 posts max.
Mm.
So I didn't have much option for job opportunities. And I was really not, all of us never discussed careers. That's what we classmates, when we get together, all of us have done well. We have done something impactful in our careers, but we had never discussed careers.
Yeah.
We were only enjoying ourselves and talking about day-to-day things and no future plans at all.
Yeah.
Then marriage was the first thing that happened. So as soon as I finished my post-graduation, got married. Didn't seem the wrong thing to do because there was no choice to make.
Mhm.
But one thing I was clear that I want to continue to work and improve as a learn more and be in this profession. That was very clear. So that was a condition also. I was trying, when this proposal came, that was one of my conditions. I want to continue to work. I didn't know how I will work or what I will do, but I wanted that option. So that's how I started working. When I went to a tea plantation, I got married to a tea planter.
Yeah.
And I still remember Dr. Karan's comment. I don't know whether you've heard this before. So she has a Kurgi friend. So she got to know of my engagement. We're a small community in Mysore, right?
Yeah.
So I went to submit an assignment and she looks at me and says, what is this? You're getting engaged to a tea planter?
Mhm.
Oh, yeah, how I am blushing here and she's holding me. She's saying, you wasted a seat. We're not going to use that seat. Why did you decide on this marriage? I said, no, madam, I will definitely work, madam. What, you will work in a tea plantation? And she was just very upset and she signed it and sent me off.
Yeah.
And then I started the center in Munnar. In Tata Tea, I convinced the chief medical officer to start a rehabilitation center division, and I invited her.
Yeah.
And of course, she was very happy and surprised that I had set up a thing in a tea plantation. I had in the hospital. I had set up a unit. I had about 15 children,
Yeah.
and I had a good speech therapy thing going. This department going, audiology and speech therapy. We had camps, and we would dispense hearing aids.
Yeah.
So I did work in those 5 years too, in the plantation district.
Yes.
So that's what is unexpected. But I think just the passion to work, then any problem I have, I shall overcome it.
Mhm.
I guess that's what kept me going when I look back. Because in Munnar, I had to drive an ambassador car for 30 kilometers in the hilly region. And I had never driven any time before.
Yeah.
But I took the challenge because I was so eager to work.
Mhm.
I think my interest, my passion to work was so high that it helped me overcome all my barriers.
Mhm. Have you faced any obstacles in your journey? How did you overcome them?
That is the answer. I think the passion is so strong that I just enjoy doing it. I feel that I don't feel I'm getting, and it's a job.
Mhm.
It is relaxation.
Yeah.
I don't get stressed at work at all.
Yeah.
People, of course, the parents and the therapist's attitude, all that will stress you out.
Yeah.
But the actual work is so motivating for me that I don't get tired.
Mhm.
So I think when I look back, that must be the reason why I could do everything.
Yes.
They were so difficult. The institute was so hard. The clinic, the first clinic, managing the patients first time, when they would talk and then they would fight about the fees, and then I'd feel so embarrassed. And I'd say, what am I doing? Just close it and go. But then I would get back next morning with the same enthusiasm and go to work.
Okay.
So I think the love for the job is so much.
Yes.
I think that must have got me through, I think.
Yes.
So that's why my niece, when she told me, Cambodia, are you willing to start? I said yes. Why? Because I just love to work with different types of population
Yes.
and different children. I said, yes, let's try it. Why not?
Yeah.
Then we worry about the problems later on.
Yeah. Yes.
So that's the difference, I think. That's what I think made it possible.
Yeah. How do you maintain a balance between your duties as a business owner and your responsibilities as a parent or a spouse?
See, we women are great multitaskers, right?
Yes.
For us, it's not a big deal. I don't understand when you ask that question. We just manage it. We are, I think, naturally equipped to manage.
Yeah.
I don't think I am the only woman doing it. There are women who have done much, much more than me.
Yeah.
And we have managed it. We know how to do it.
Yeah.
I don't know I can't decode it. It just comes easily.
Yeah.
Of course, I think every woman always will say if she has been able to balance it is because the support system is so good.
Mhm.
Right? So I think that is the key.
Yeah.
My parents were there anytime I needed them. My children were very understanding. My husband was very understanding. My in-laws were very understanding. I had very good help. My nanny for my children was very good. She stayed with me for 20 years. So there was a continuity
Mhm.
for my children when they're growing up. And another nice thing was that I started my career actually by the time my children were my youngest child was already 8 years old.
Okay. Mhm.
Because when they were young, I was very clear I didn't want to work full time. So I took up a part-time job when I came to Bangalore. And even the Tata tea in Munnar, when I was working 3 times a day, three times a week, sorry. So when my kids were small, I was very clear that I have to spend the afternoons with them. That time, I think it was easy for me to make the decision because I didn't have to think twice. I was very clear. And when I'm clear, I don't get stressed. I don't have to ask anybody. I decide, I've said, no, I don't want to work. After my kids are grown up, let me see. So I came to Bangalore and Dr. Chandrasekhar gave me a part-time job he had never given to anybody. I don't know whether you are aware, I worked for Chandrasekhar Institute for 8 years in a part-time capacity. Because I told him I can come, but I'm only going to come half day. 3 times a week. I started 3 times a week. I made it every day. After 2 years, I think. So at that time, I was very clear that I don't want to balance. I want to be home in the evenings. And after that, it was very easy. I don't, it was not difficult. Because I had a good support system. Anytime I have a good circle of family and friends. And whenever I'm in trouble, anything, I don't need to ask anybody. In my family, I'll find somebody to guide me. I'm confused about finance. I'm confused about building. I have an architect. I'm confused about writing a proposal. I have somebody in the family who will design it for me. So I think that was a very positive thing. That's the support system that I had. And now my children are my support. I bounce ideas with them. My son-in-law also is in the field. So if I have an idea, I'll ask him for suggestions. We discuss how to implement something. So I think that is a very nice thing that I've had.
So what advice would you offer to women interested in starting their own institute or therapy center?
See, first, you must love your job. You should be very clear why you are starting a center. I was not looking for money. Okay? I never worked for money. I said, I want to be able to hands-on do therapy. Money was important, but it was not the most important. All right? I was excited to be able to work with children on my own. I didn't want to supervise. Like in Chandrasekhar Institute, I was supervising. And I did one aphasia case because that aphasic patient, he came through a referral of my friend. And I asked Chandrasekhar, sir,
1 minute.
I was working in the school.
Sorry, ma'am. Awesome.
My first stint in Chandrasekhar was working is in the school for deaf children, Samvaad school. All right. I was working with them and then I got burnt out because I was not happy with the progress we were making with the children because they were wearing cochlear. There were no cochlear implants. Then we were working with profoundly deaf children. So that was very frustrating time and the progress is not there and you're working with a lower class. Parents are not educated. How to get them to do more speech stimulation? No, not happening. So after 5 years, I said enough. So when I wanted to quit, Dr. Chandrasekhar said, why don't you do public relations for me? So I said, I don't know what public relations means. I just know how to be a therapist. And I had thought I might go and get attached in any school. And work in a school was what my plan was after leaving Chandrasekhar. But he convinced me that I can do public relations. And anyway, I said part-time option. He said, okay, part-time. So that's why I said, let me try. So I jumped at that opportunity, which was a turning point when I look back. Because, why? Because from a quiet person, I learned to communicate. I changed, my personality changed. I learned how to express myself, how to talk about an institution, how to raise money for an institution, who I really believed were doing good work. So I slowly learned about how to do that. And that was the foundation to become my independent clinician. I think that was the formation that my strength came because I became confident of talking to people, handling the press, everything, managing so much money, all that I learned. I raised funds for Chandrasekhar Institute. I organized 2 events in Chaudaya Memorial Hall. So all that experience, I think, gave me a confidence. But then one day, I was getting bored of fundraising also and going around talking to people. And I got an aphasia patient who was referred by a friend of mine. And I gave them to one therapist, but she was not free at the time when they were free. And I have always loved therapy. So I told Dr. Chandrasekhar, can I see him every day 1 hour? He said, okay, but don't let your duty suffer. I said, okay, I won't let it suffer. I'll work 1 hour extra in the afternoon. So I took therapy for that patient. And what a change. He improved so dramatically. I was so motivated and I said, I can do aphasia therapy because I didn't want to work with deaf children anymore. And I said, now what do I do if I go to a school? And I said, and I loved the therapy. 6 months, the guy who had a brain damage, head injury, he was not talking. He had severe behavior problems. I solved those behavior problems and got him to communicate. So then I decided, I told Chandrasekhar, sir, I'm loving therapy. I want to get attached to hospitals and I want to work with aphasia patients. And so I quit Chandrasekhar in 2000 and joined HOSMAT Hospital as a consultant speech pathologist. And then I joined Manipal Hospital also as a consultant. But after 2 years of doing home visits and hospital visits, I realized it's not enough work. Every hospital generates little bit cases and they don't last. So I realized aphasia, adult aphasia in 20 years ago, nobody was willing to come for regular therapy. Their families had no hope. I couldn't give dramatic results. I knew somewhere I was getting stuck. I couldn't progress beyond a point. So I also was frustrated. Then I said, let me get back to children. I like working with children. I will learn autism and I will start, because by then autism had become a big deal. Too many clients, deal had started. So I said, I learn how to do therapy for autism and I can do all stuttering, articulation, aphasia if it comes to my clinic, well and good. That's how the clinic thing came, because hospital was not giving me enough work, not satisfied. How much assessment can you do? Every day I would go, I'll do assessment and 3 days later, patient discharge. I got 2 years of doing that, I got bored. And then I thought, let me start my own clinic. So that's how Samvaad clinic started. The institute came second, after first the clinic started.
Many speech and hearing professionals are graduating every year. What advice do you have for these young professionals?
I would say keep improving your skills. Keep your focus very clear. You want to become a good clinician, you want to become a good audiologist, keep upskilling yourself. Be open to feedback, be open to learning, jump at opportunities. Wherever you get a good opportunity to learn, jump. Don't be scared of jumping and trying new things. Have only one life. There's no need to regret later in life. Try it. If you fail, it's okay. At least you tried, no? Because sometimes it can click. Like I took a risk of being a PRO, it clicked. I took a risk to start a clinic on my own. It clicked. If I had got scared and thought, what will happen? What will happen? Will I do it? Will I do it? Try. Trust yourself. And do. And take the jump. Take decisions. Take opportunities. You will improve.
Yes. Thank you for doing the interview, ma'am. Those were the questions. I believe that many of the young professionals will find it very um, helpful from this interview, hearing you talk about passion and believing in yourself. So I'm very thankful for this interview. Yeah.
Thank you. I grateful for the opportunity and thank you so much. Enjoyed myself.
Mhm.